I'm Henry Mwandumba. I'm Director of the Malawi Liverpool Wellcome Research Program here in Blantyre. But I'm also Professor of Immunology and Infectious Diseases, both at the Liverpool School of Tropical Medicine in the UK and also Kamuzu University of Health Sciences here in Blantyre. So the program's vision, certainly for the next decade, is to be recognized as an Africa-based beacon of excellence in health research, mainly focusing on research that is innovative and will change practice, not only in Malawi but globally. And to achieve that, we are really driven by a mission where we want to conduct high-quality research and train the next generation of researchers and leaders to benefit health, focusing mainly on human health. Radiology or radiological investigations or tests are a huge part of clinical service, and they make a huge difference in the way people make or the way clinicians make diagnosis of different conditions. So if you look at facilities like CT scanning or MRI scanning, ultrasound scanning, these are all really important tests that will help the clinician to confirm a diagnosis. So for countries like Malawi, this is an essential service because it will give clinicians the confidence in the diagnosis they make from clinical assessment of patients. And obviously that also translates into accurate treatment for the patient. So you make the right diagnosis, you give the right treatment, and the outcomes then obviously are going to be better than if you didn't have those services. So as a research program, we work very closely with the Ministry of Health, and here in Blantyre through the Queen Elizabeth Central Hospital, but also in other districts through health facilities. And our role there is not only to offer clinical service as part of our commitment to these institutions, but also to provide training by way of offering opportunities for capacity development of people working within the health facilities. So for example, we do have the CREATOR Fellowship Program, which is really designed to improve the training of clinician scientists. But a lot of clinical staff from the hospital, either clinicians or nursing staff, we support their training, either training courses that will be relevant to them. But with specific reference to radiology, we have contributed to the training of people working in the radiology department in areas like ultrasound scanning, but also CT scanning, by paying for those courses, but also for tutors who come to train on these courses. So our commitment to capacity development is huge, and we want to maintain that going forward. So the CREATOR Fellowships have been running for about 3 to 4 years now. And I mean, the whole idea was to link the fellowships to this building, the Clinical Research Excellence and Training Open Resource, which is CREATOR. And the thinking behind the CREATOR project was to improve the training of clinician scientists. So these are people who train as clinicians, but we would like to encourage them to do research as well as part of their career. So we've offered these fellowships to people who are training in internal medicine, in pediatrics, and the radiology one was the first one because we'd like to expand the pool of people who have access to these fellowships. And you can imagine that there are radiologists who are interested in not only clinical work, but also research because they want to understand certain principles in radiology that one can only do if you conduct proper research. So it was a delight for us to be able to offer a Creator Fellowship to a radiology trainee at Queen Elizabeth Central Hospital. So partnerships are critical to the work we do. And in fact, if you look at our values, we have 4 values: excellence, integrity, inclusivity, and partnerships. And we cannot deliver the amount of work or the quality of work that we're doing without those partnerships. So the Worldwide Radiology partnership is extremely important to us, because not only have we worked with them to enhance radiology training within the Ministry of Health, certainly at Queen Elizabeth Central Hospital, but that team of radiologists have been really instrumental in helping us interpret a number of the radiology investigations we do as part of the research that we do. So studies that are, using CT scans or ultrasound scans, you need a trained radiologist to interpret those images. So there have been several studies at MLW that have utilized the services of Worldwide Radiology to get the data that they want. So this is a really productive partnership. But in return as well, we have been, very helpful to Worldwide Radiology by offering the facilities for training. So ultrasound training happens here, but also in the hospital as well. Having a cohort of Malawi-trained radiologists would be a huge milestone for the country. Currently, Malawi has very few trained radiologists, and these are mainly in Blantyre and Lilongwe. But what this milestone will signal is that capability that the country has to produce high-quality radiologists. And what that means is that the service can be spread out across the country and not only be concentrated in Blantyre or Lilongwe. So for Malawi, this would be a huge milestone, and the impact it will have on clinical service will be similar to what we see in departments that have been able to produce locally trained specialists, for example, in pediatrics or in medicine, in obstetrics and gynecology, and that just improves clinical care. And I'm really hopeful that this milestone will bring the same in radiology. My thoughts first are to say the work that those who support Worldwide Radiology have done has been incredible, but the impact of that work has been phenomenal for countries like Malawi. The work that they have supported has enabled the training of various groups of people in ultrasound scanning, for example, and those expertise are really handy not only in the radiology department but also at the bedside. So a lot of clinicians have been trained to do ultrasound scan at the bedside and make quick diagnosis and accurate diagnosis, which improve patient management. And that impact is huge, because you get good outcomes when you start the appropriate treatment for a patient. So my message is really to encourage the supporters, the funders of this program to continue, because the impact is huge, and I think the return for the investment they put in is also very huge.